The disorder that I will be discussing will be the opioid use disorder. What is opioid use disorder? Opioids are powerful pain relieving medications that can also be highly addictive. They increase dopamine in the brain, creating feelings of pleasure or euphoria, but these effects are temporary and fade as the drug wears off. Here's a few things about opioid use disorders that you may not know. The opioid use disorder is currently the fastest growing addiction in the United States. Mis- Misuse of certain prescription drugs can lead to opioid use disorder. The use increases the risk of criminal behavior. Those that use heroin are at risk of for HIV, AIDS, or hepatitis C. There are three different categories of opioids: natural, which would be things like morphine and codeine; semi synthetic would be heroin; and synthetic would be methadone. There are some risk factors to consider when discussing opioid use disorder: genetics, co occurring mental health disorders, social and environmental factors, and medical factors as well. When trying to use the diagnostic criteria, you have to consider the misuse of prescribed medication longer than intended, unable to control opioid use, trying to obtain the opioids is consuming a large amount of their time, feeling the need to use the substance, using the substance is interfering with obligations such as school and work. When considering the diagnostic features, you should consider that this disorder often progresses from voluntary use to compulsive use, driven by craving, avoidance of withdrawal, and losing control. Also, presenting psychological features would be social isolation, relationship conflict, legal problems, and financial stability. Withdrawal symptoms include muscle aches, sweating, nausea, diarrhea, anxiety, and insomnia.